Hi, Dr. Patel.
Hi, Yashoda.
How are you, Padmaja?
Wonderful, wonderful.
So good to have you on.
Well,
I really appreciate it. I really do.
thank you. Thank you for giving me this opportunity. I'm excited to share my journey.
Awesome. So, Padmaja, you and I have been chatting a little bit before we started this broadcast, and I just want to acknowledge to our audience. First of all, I want to thank our audience for being here, for taking the time out of their busy lives to come and join us while we have a conversation about lifestyle medicine. But I think it wouldn't be right if we don't at least acknowledge what's going on in the world right now, where there's a lot of suffering, there's a lot of pain. 2020 quite hasn't worked out the way I think any of us imagined. We had the pandemic, we're still in the throes of the pandemic, and now we're having all this violence that's going on in America. And I think you and I, as immigrants, we definitely feel the pain on all sides. And so I just want to acknowledge that this is a situation that is really heartbreaking, and that we're here to support everybody. I think we need to support each other as physicians. We do belong in sort of a privileged class because we are doctors, that we have credibility in our society and in our communities. And how do we help our patients navigate this, right? Like that is such a big part of what we do, whether it's lifestyle medicine or not. So I just wanted to kind of put it out there. Did you want to also say something about this before we start?
Well, I totally with you and comments. As a minority ourselves, I think we all can relate to everything that's going around, and all we can do is share our peace and work around understanding each other's sentiments and in these times, especially where I am. In addition to pandemic COVID-19, we also had some economic challenges. So I can relate that in addition to the racial tensions right now, yeah, I think we're all going through some sort of turmoil. And as provider, our focus remains on patient care. So I think we should still continue to talk about how can we as a physician continue to share our passion of taking care of our patients.
Yeah, yeah, thank you. So well said. I really appreciate that. So Dr. Patel, Padmaja is I think, amazingly accomplished physician. She's an internal medicine doctor, and she works in Midland, Texas. She actually has been instrumental in starting the lifestyle medicine clinic in Midland, and she wears a number of different hats. And if I can just share that little story, Padmaja, about how our coincidence. So turns out that I reached out to Dr. Patel really because I was impressed by how much she was able to accomplish in the lifestyle medicine movement. And we started chatting. And actually, she happened to be in Hawaii at that time, which was also interesting, but on a different island. And we started chatting, and we came to the realization that we had actually been classmates in the first year of medical school back in India. And we couldn't recall that. That was too funny. But then we got to share about, how the boys were and all of that. So it was kind of really funny, 30 some years ago. So I thought that was a cute story, like how our paths cross, all the time. So,
It was very funny because me being in Hawaii at the same time, and here is another doctor from Hawaii, and I thought, this is weird. Is this Facebook doing this to me?
right? That was funny. I know. I know. Oh gosh. So, all right. So we do have some audience, and I just wanted to remind you guys, you can actually click on that link that says StreamYard / something, and you can put in your name so that instead of it coming up as Facebook user, we can actually see the names. But if you don't want to do that and stay anonymous, that's fine too. So I'm going to let Dr. Patel kind of go over her journey and talk a little bit about her current practice, and then please, start asking questions, and I'll start. We'll save them for a little bit later, and then we can start going through the questions as they come up. Okay?
Perfect.
So, do you want me to share your screen yet, or do you want to just kind of talk about your journey a little bit before the screen with your PowerPoint?
Sure. Let me just briefly share my journey. It all started in 2015. I attended a all-day seminar called Food is Medicine by Dr. Scott Stoll. He is the co-founder of the Nutrition Project. The seminar was local in one of our local church in Midland, Texas. It was arranged by my friends, Dr. Staten Autry. He's a cardiothoracic surgeon, very passionate about the concepts of whole food plant-based diet and the benefits the nutrition can make in a patient care. So after attending this seminar and looking at this compelling data on the impact of nutrition, it really changed my overall thinking. Being a vegetarian myself all my life, I realized that we, and Yeshua, you know that, those of us who are from India and still eating vegetarian diet, it's not healthy. And, we see the same disease pattern of all chronic diseases, including heart disease, diabetes, high blood pressure, high cholesterol within our friends and families who eat that kind of vegetarian diet. So I realized that there's so much to learn from this concept of lifestyle medicine and simple choices you can make in our lives, such a profound effect it could have. So not only that I started making changes in my own lives, but I started talking to patients, and I found that pretty interesting because, all my life I never necessarily addressed nutrition much with my patients. Even though I was a vegetarian, I didn't necessarily address that topic, but I realized that patients are actually very eager to learn. And when we talk about nutrition or behavioral change, we can actually have much bigger impact. And they listen to us, they're wanting to make changes, and they need authentic source of information. So as they started making changes, I think they really fueled my passion. So gradually, I think it all started from a conference that I attended in 2015. So let's start my screen share, and then I can talk a little bit about what happened after that.
Great. I'm just going to double check on Facebook to make sure that the technology is as it's supposed to be.
Okay. I'll wait.
Yeah, let me just here. Yeah, we're on. Yeah, looks good. Yeah.
Okay, cool. So this is Midland, Texas, by the way, the picture right here, and where it's part of West Texas, Permian Basin, oil and gas rich area. So I think I can share that every practitioner who's looking at lifestyle medicine, faces these typical challenges. Number one, time commitment, because in your routine 15, 20-minute office visit, it is very difficult to have conversation about lifestyle behaviors. Again, even if you end up spending a lot of time, there is really no clear-cut reimbursement model at this time. And then in addition, a lot of times you need additional staff, you need a clinic space for educational resources and teaching and cooking demonstration, and a lot of other things that many providers do. So I felt that this is not something that I could do single-handedly in my own practice. And so I felt that if I wanted to have a bigger impact in the community, it would be better to sort of align with hospital. So we have a community hospital, non-for-profit, Midland Health, in our Midland, Texas. Fortunately, they had changed their mission statement just a year before all of this started. And the new mission was to make Midland the healthiest community in Texas. And so that made a lot of sense for me to bring lifestyle medicine in the conversation, because how do you fulfill that mission? And the other aspect of bringing lifestyle medicine was that hospital was self-insured and was spending a lot of money in healthcare, the employee health. Every year, that funding was going up for places. So we proposed the idea of having CHIP. We're using CHIP, Complete Health Improvement Program, as employee health, which was how we wanted to start initially, to sort of prove the model so that we can expand later. At the same time, hospital was forming ACO, a clinically integrated network. And so I made an argument that, if you want to improve health outcomes at a much lower cost, you have to bring lifestyle medicine into the conversation, and you have to have some place where all these individuals can go and improve their outcome at a much lower cost. So it made sense to have a lifestyle medicine program to our CEO. What we did is we started with the IRB study of 30 hospital employees. Majority of them had diabetes. We enrolled them into 12-week of CHIP program. And then in the end of 12 weeks, we proved that majority of them had lost weight or had improved their A1C outcome and blood pressure. Some of them had to take off, medications completely. So there was cost savings and improved health outcomes. Later, we started working with the cafeteria food, improved choices, as well as making plant-based dish available every day. And we also made sure that the inpatient hospital menu was offering plant-based options to the patients admitted in the hospital. So it really kind of ripple effect of creating this culture of health. It invited CME lectures. We would have Dr. Clapper and Dr. Esselstyn and others that we would invite. And so physician community would learn a little bit about what this is. And then hospital arranged for first Food is Medicine event in the community, and they sponsored this event where we invited 4 to 5 experts, Dr. Greger and Dr. Stoll and others, for all-day event. Almost 500 to 600 people in the community attended this event.
Wow.
Yeah, and so you can imagine planting the seeds in the community of this education, and then the ripple effect of what that can do in the community. So some of us who were very passionate about the concept of whole food plant-based diet, we realized that this hospital was doing some of the things within the hospital, but there was a lot more that we wanted to do in the community. So we run a nonprofit called Healthy City. It's 3 of us couples, we co-founded that. And the mission was to promote awareness about the benefits of whole food plant-based diet. And this is really focusing on disease reversal.
Mm-hmm.
One of the main things that we've done over the years is Food is Medicine, which we continued after the first event, which was sponsored by hospital. We took over that. Again, every year we have about 600 to 700 individuals come and attend these seminars. Then in addition, we started community talks every month. We've been doing that for more than 5 years now. Every month, people gather, about 50 to 60 people, at least average. We would have share them, send them recipes, and they bring the potluck meals, share testimonies. There is usually a small educational talk or presentation. And then we also offer cooking demonstrations. We work with the local food bank to do the cooking demonstration. There are grocery store videos that we made it available, but there are in-person grocery store tours that we arrange. And they're very popular. People sign up for them, and one of our board members will actually take them to the grocery store aisle by aisle and kind of helping them make better choices of food, how to purchase, what to look for, how to look at the nutritional labels, and things like that. So this is a source. I wanted to share the link for the website. It's the ourhealthycity.com, and there are a lot of resources that are freely available on our website. So just wanted to show Dr. Greger here for one of our Food is Medicine. He's come through a few times actually, and he loves coming to Midland, Texas. This is our monthly potluck that I wanted to share. But we've also created a restaurant guide, which is for people if they were to go out in a restaurant locally, what kind of food they should be ordering. So are there any healthier options that they could order? So we've got this 4-page long restaurant guide. There are grocery store videos that are available. Anyone who's interested to share with their patients, feel free to do them. There are 6-part videos which really kind of go in depth. One of our board member of the nonprofit is also interested in gardening and canning. So those are also some of the videos that are coming up on our website soon. At the hospital, we were doing all this within the employee health, but we weren't necessarily at that time, we didn't have a program or anything for the community. So I was able to have a conversation with our CEO and a CMO to create this lifestyle medicine program under this big umbrella and kind of create a business model. And so some of the programs which have been around, for example, Ornish program or CHIP, they have a proven model. Ornish actually has a reimbursement model, which is something that anyone can start. So it's an intensive rehab under the category where the reimbursement is quite good, depending on the area, but Medicare reimbursement varies from $108 to $110 per hour. And it's a 72 hours of intensive cardiac rehab that patients who have had a history of MI within the last 1 year, those who have had a stent or PTCA or angioplasty, or those who had a history of congestive heart failure with a ejection fraction less than 35%, history of valve replacement. So these are all typical cardiac patients. Mm-hmm. They go through this program instead of the traditional cardiac rehab, which is only focusing on exercise. Here you have the 4 elements of lifestyle medicine and actually double the reimbursement. So that's what we brought the Ornish program. We were actually the only in the entire state of Texas offering the Ornish program. And, recently we're now actually moving on to Pritikin ICR. It's the same based on lifestyle model, but it is less intense in the sense of resources. In order to be a medical director on a team of 6 individuals, you need a program director, you need a clinical nurse manager, you need an exercise physiologist, you need a registered dietitian, stress management support, and group support, which is usually a counselor. In Pritikin, you only need a registered dietitian, medical director, and a nurse. And it's easier to enroll, and reimbursement is the same. So I think, financially, it will be a better decision on our part as we move forward with the Pritikin ICR. In the meantime, we opened up CHIP to the community. Anyone in the community who was interested in doing an intensive lifestyle program to do the diagnosis or to justify. So the good part about CHIP is that you don't need a physician. It can be done by a trained facilitator. It could be a nurse or it could be non-medical. It doesn't matter. It's a 12-week program. Cost of CHIP is running CHIP. It's per patient. I think you have to pay somewhere around $300 or $350 to CHIP, and you could charge patients anywhere between $600 to $800 or more, whatever you want to charge. So that's the program for some of the providers that, either a health coach or somebody can actually run this 12-week intensive program, and you can enroll patients. And you don't have to bill insurances because there's no insurance payment model yet. Patients, and it's a pretty good intensive therapeutic program. Focuses on all 4 elements of lifestyle medicine.
I understand that the CHIP program, though, is also now they have like a self-study model, so patients can actually like bypass us, I guess, and go to the website and sign up and do it themselves.
Well, I don't know about the self-study, but they do have a hybrid model, which means earlier they used to have in-person classes.
Mm-hmm.
People have to come to the class twice a week. But now we made it available online, which means people from their home, they can just join into Zoom, just like a Zoom webinar, just go through those classes, so they don't have to. So a lot of, you can use this chip as a employee wellness also. People can join in from their office during lunch hour or whatever, and it can be utilized. So I think convenience is a big factor. I think COVID-19 is also forcing the alternative ways to offer healthcare.
Yeah.
So this was just a picture of our opening of the lifestyle medicine program in the center here. These are the programs that we offer under the umbrella of lifestyle medicine program. Intensive rehab, traditional cardiac rehab. We have a diabetic and nutritional learning center with registered dietitians. We also offer a Better You online wellness portal, which is online currently for hospital employees. Our plan is to actually offer this as employee wellness to local employers. Again, CHIP is being used as employee wellness as well as community CHIP. And then we have a lifestyle medicine clinic, which is there 1 day a week. And we offer lifestyle medicine classes. And I'm going to just talk a little bit about that as well. So clinic, again, just like any other office visit, but the focus really is on the 6 pillars of lifestyle medicine, creating a lifestyle medicine prescription. I usually build just the office visit codes, E&M codes. It could be, new patient code or a follow-up visit codes. And nutritional counseling with a registered dietitian is also available. So dietitians would do their part on a separate visit. We also offer stress management classes, which they can sign up for. Again, those are $5 charge per class. We made it very nominal cost on that. And then we also recently started a diabetes program, and I'll share a little bit about that as well. But in addition, we also offer weekly lifestyle medicine classes, which are open to anybody in the community. And again, you can see the list here. We really focus on all 6 pillars of lifestyle medicine. And here, the picture, I'm giving a talk on Eat to Beat Cancer. These are very popular classes in our community. People sign up ahead of time. And again, we only charge $5 for that. This is just sort of more as an introduction. Figure out what you're doing. They come to the class and they end up signing for something or the other, or come to the clinic, or come to the diabetes reversal program, or something like that. So this year I started a 12-week of intensive therapeutic lifestyle program for focusing on reversal of progression of diabetes. Again, it's a team-based approach. Myself, physician, and in addition, we have a health coach, registered dietitian, exercise and stress management expert as well. So in the 12 weeks, people come 6 times, 2-hour session each time. And we had made this virtual option on a webinar on a Zoom just during the COVID-19 for about a month and a half. And we have continued that option. So we have two sorts of cohort going on right now, in person as well as online virtual platform. Billing right now, we use a shared medical appointment code for, which is just 99213. Visit code for 8 people in a group, and then dietitian will bill for their time. So I think their code kind of, it's a 30-minute section, so it's twice for total 1 hour of dietitian time and 1 hour myself. Why dietitian is, so initially, I'll do my talk, and I do only once a month. So only 3 classes I took for this 12-week program. And during the time of the session, after I finish my presentation and talk and finish up the Q&A, I see them one-on-one briefly, just to kind of justify the visit code and kind of go over anything that they need, like the prescription, or if they have any questions that were not addressed in a group. We offer this ongoing support, which we're not getting paid for right now because there is no reimbursement model for health coach. And then same thing with the stress management expert. There is no additional reimbursement for that. But the fact that I see the value in all of these, I work with a hospital, which is what makes all this possible. So I think overall, we want to prove the model that ongoing support is such an important part of important element of overall success.
Yeah.
Right. Yeah. And so we wanted to make sure that someone is keeping a tab on them, making sure that, looking into any challenges or barriers they're going through and how we can help them overcome those.
Yeah. Yeah.
The other aspect that I feel about any lifestyle medicine program is community awareness. You could not be just sitting in your own office and talking about lifestyle and thinking that people are going to trickle in there. I think it's very important that we have to reach out in the community, and any opportunity that we get to talk about it and share the information and knowledge. So I've been in the last few years going to so many places within our community and outside, just talking about different topics related to lifestyle medicine. Writing newspaper articles periodically, and the good thing again with the hospital being, local only hospital in town, they have this every Wednesday. There's a section called Health and Wellness, and anytime I want to write something, it's always available. So these options, I take full advantage of. And social media presence, we haven't necessarily done a whole lot, but we're getting there. We realize that patients do need to know. Sometimes, they learn a lot from social advertisements and media advertisements. And my feeling about this entire movement is it's a ground up, right? I mean, it's not top down. We have to do a lot of work within the community, bring that awareness. Patients should learn about it. Sometimes they don't need to wait till their doctor tells them about a lifestyle medicine provider.
Right.
So I think it's something that we have to sort of think about outside the confines of our office space, and continue to work with the community leaders, city council, mayor, whoever, all the leadership, and sort of share this vision of what local community should look like, or especially the population health initiatives. Right. So these are the things that I'm currently working on. Is a 15-day jumpstart, which I've been doing a lot of homework and learning from everyone that has had a successful program, and I'm going to create my own version of that. And I'm planning to build that jumpstart for just like how Dr. Ted Barnett the other day he mentioned. I would say it would be similar to the shared medical appointment model, for a group of 15 to 20 people. And it could be E&M codes 2299213, which you can bill easily for that. And my hope is to create 3 Saturday, first and third Saturday you can actually bill. The second Saturday you do not bill that. That would be more a potluck or a community discussion, just a cooking demonstration, just sort of, physician will not be involved for the second Saturday. That's how I'm looking at. And so we're ready to kind of finalize that program and hopefully offer, once the concern about these COVID-19 and social distancing, it's really kind of putting a little damper on it right now. The other thing that I'm working on is a smoking cessation program. It's one of the pillars of lifestyle medicine, which I think we need to address as a program. And the congestive heart failure is something that we've seen during Ornish program delivery, that significant improvement in the heart function with lifestyle medicine intervention. So our leadership is interested in creating something separate for CHF patients, because those are they keep coming back to the hospital.
Right, they're big. There's a lot of money that gets spent on care of CHF.
Yeah. So it's a diagnosis where a lot of hospitals are losing a lot of money. Correct. So I think that's a good way to bring lifestyle medicine program again for that. And the inpatient consultation is something that I would like to do as soon as we're in the process of hiring a nurse practitioner that will join me. So I think I need a little bit of help. We want to do that. And then the population health, which I think that in many ways we can bring lifestyle medicine concept on a bigger scale, just to improve overall population health. So these are things that I'm currently working on. So I think if you ask me, I think a lot of people wonder how we were able to do all these things within a small community with the hospital support. And I think that there are 4 things that are necessary and kind of help for this overall success. One of them, obviously, you need physician champions. We have had quite a few in our community who totally believe in lifestyle medicine and support this idea and have been really huge champions for the overall movement of lifestyle medicine. The healthcare system support, right? You need executives and you need your CEO and you need your vice presidents on board. Right. One of our vice presidents actually, early on when we were actually talking about the lifestyle medicine bringing to the hospital, she was part of our conversation, attending meetings. And just around that time, she was diagnosed with multiple sclerosis. And she was put on some medication which she couldn't tolerate. So she realized, how about I try this nutrition aspect these people are talking about? And so she completely joined, 100% got onto a whole food plant-based diet. And in 6 months, she completely reversed her multiple sclerosis. She had a big lesion on her MRI, which was within 6 months, which was almost gone. So, so her personal journey and powerful testimony was something that really helped us, because now we had someone within the C-suite who was totally supporting this idea. And so her passion, she's also part of our nonprofit as a co-founder. So, we're fortunate to have such passionate members in the community. And we've got a lot of support from the hospital because they've seen what we have been able to do with each program. And then I think community engagement. I think this planting seeds of knowledge and information are, you may not necessarily realize, but now we know that each year when we have this Food is Medicine, about 600 plus people come to this community event for all-day seminar. And they go home and share to their families and friends. And so, interestingly, in this small town, whole food plant-based diet is not a new idea or new concept anymore. People have heard about it. they know someone is doing it, or they know someone who has completely reversed their disease. So interestingly, now in my lifestyle medicine clinic, I have patients who come and their first statement is, I want to reverse my diabetes. Okay,
Mm.
here we go. So
Yeah,
I
it's
don't have
not
to,
being
yeah,
really
I don't have
wise.
to waste,
Yeah,
yeah, yeah. No, they are in this action phase, right? I mean, we
yeah,
don't really worry about, wasting time in convincing them. They've heard it, they know it, they've read it, whatever, they're ready.
yeah,
Yeah.
yeah,
So it's a very different feeling, but it required a lot of work, obviously, over the years
yeah,
doing what we did. And then,
yeah. It definitely didn't happen overnight. Yeah, there's no quick fix to this thing, right? Like you really have to kind of slog away at it and really be, wake up every morning and say, this is my passion. And
yeah,
I can see my vision, but in order to get to that, these are the steps I need to take today and tomorrow
absolutely.
and the next day and the next day and the next day. Yeah.
Right. We just have to be persistent, right? Because everyone doesn't have the same passion as we have, right? I mean, you have to understand that it's going to take time. It's going to take time for people to buy into completely. And so we just have to be patient and persistent with this idea, and hopefully, things work out for us. And then obviously the importance of having this nonprofit that we created, that really creates this community support element,
Mm.
which is sort of ongoing. So we just have to plug people into this monthly potluck or something like that, and just kind of creates that support. So yeah, I think all of these things work together to create a successful model. So
Mhm. Mhm.
yeah, I think this is going to be my last slide. So I'm gonna just.
Great.
All right.
So, wow, that was amazing. I love that presentation. It's, I mean, and when you say it takes time, but when you look at what you've done, it's only been 5 years,
Yes. Yeah.
right? Like to me, I would think this would take 20 years or something, right? But this was, when you look back, you're like, yeah, in a relatively short period of time, you have been able to accomplish a lot. So
Right.
sometimes I think we don't give ourselves credit for that, right? And it's like you got to take that first step, and then the following steps will follow, kind of thing. So I think that's the message that I got from your journey and your presentation. Um, so I want to again encourage the audience to try to start asking questions. I know there's several of you on here live, and that's wonderful. And I want to make sure that we get your questions answered for Dr. Patel. Um, so I think the thing that comes up for me is, so you were practicing just traditional internal medicine before all of this happened. What was and then you went to the conference and you got motivated. So what was your messaging like when you decided to take it back and try to like start incorporating it? Did you just start like with your patients, or like did you start dealing with some of the higher ups because you knew probably right away that this can be a one woman show? You're going to need to have to pull in more people to help you support grow this movement. So let's say there's somebody like in your situation, they're an internist, they're doing, regular practice, and now they're motivated to do something. What would be some of the next steps that might help, like that help in your journey that you could share?
Right. I still have my private practice internal medicine, which I do 4 days a week. Again, my passion for lifestyle medicine is very much there. So I still communicate and talk about that, but I may not have time to dive deeper. So I actually refer my own patients to my lifestyle medicine clinic. So it's just sort of, self-referral, because here I have more resources, more time, makes it a lot easier.
Mm.
When it comes to bringing lifestyle medicine into private practice, whether it's family practice or internal medicine, I would say shared medical appointments, possibly a good model to make this a financially viable option, because it's the same prescription, same conversation. You put people in one room and communicates and sort of go through. And you may hire a health coach either online. I know Heather was talking about it yesterday. Um, it's an option, and there are a lot of cheap options available now where we can hire such services online if you can't have in person in your own office.
Mm-hmm.
So I personally think health coach plays a huge role in overall success, because writing a prescription, telling them what to read, or it's not enough. This is a behavioral change, and it requires science of behavioral change, and you got to apply all that there is to have a meaningful outcome.
Right, right. Yeah, I mean, I say this is not so much about the food. This really is about mindset, and it has to be changed on so many levels. It's what people believe. Whether it's about the necessity to have meat in their diet, or it has to do with culture, right? Like, I mean, around Thanksgiving, what's Thanksgiving without turkey on the table? So you're dealing with people at multi levels in terms of behavioral health, and then how do you show them that connection between between what's on their plate and what their health is. And so again, a big part of it is the educational piece for sure.
Right.
And then getting, again, the community involvement. I mean, I think that's, that, and like you said, that's sort of a low barrier thing. I mean, as physicians, I think most of us tend to be really comfortable like with one-on-one interactions, with the patient in the room, or maybe with the spouse, or maybe even a family, meeting in the hospital. But I think we tend to be a little hesitant and pull ourselves back when it comes to like go and give a talk at your library, for example. Somehow we seem to have a little difficulty taking that next step. What were some of the things that you did, like right in the beginning, to kind of spread the word in your community? Some tips maybe that physicians can do regardless of the size of their community and where they are in the country.
Right. So I think initially some of the clubs, the Rotary Club, or the Professional Women's Club, or these and that, all these little clubs, they invited me, and I never said no to anyone who wanted to learn. I was ready to share.
Yeah.
So I think going to this conferences gave me an idea about what is it that I should be talking. What data? Where is the data? What should you present? What works? And when you start talking to patients, you realize what is it that they want to know. And so I think come up with your own little story of what impressed you, what worked for you, and that's just everyone wants to know. And I think if you have few patients that have necessarily transformed their health, you could share their stories. Patient testimonies are the most powerful stories to share. So I think we record those, and we periodically get these posted on the social media and other places. So I think it's combination of things, sharing, talking, any opportunity you get, whether it's church groups or anywhere, and continue to talk about the importance of lifestyle, and how we can really turn around this broken healthcare system, which is kind of unsustainable now.
Right. Okay. So Nivedita asked a question. Can you see it, Padmaja? Do I need to read out? I just made it visible. And I'm just going to check the page to see if there are any other questions, because yesterday it seemed like, or when I'm doing it with Heather, it seemed like it was hiding.
Yeah. So I can see the question.
So what is the best way to have effective and financially viable shared medical appointments now due to the pandemic, where patients want to do it online? Thank you for your question, Nivedita.
Hi, Nivedita. That's a very good question. I think we have changed our diabetes reversal program, which we're now offering on a virtual platform. I bill as a shared medical visit. So those are 1.5 to 2 hour sessions with patients. So even though you don't get one-on-one visit, like how you would do in person, you could still bill those as a shared medical appointments. And there is no cutoff as far as Medicare and commercial insurance is concerned, how many people you can have in a shared medical appointment. So there is really no guidelines as far as physician visits are concerned. In Texas, we know that dietitians are limited to having only 8 people in a group.
Okay.
Yeah, so if you have more than 8 people, then you need more than one dietitian to bill for the time. But as far as the physicians are concerned, there is no limit on the number of people in a shared medical appointments.
I see. Okay. Just have another question.
Mm-hmm.
So if your billing insurance can be used Zoom, I have to use my telemedicine platform through my EMR to bill insurance. How can group visits be achieved?
So currently in the pandemic, during this COVID-19, some of the requirements, those strict guidelines we had initially have been lifted off. So Zoom can be used for the group visits. And you could bill your usual E&M codes, 99212 or 213, based on how many people are in the group, that you would think it's reasonable to charge that. And then you have appropriate documentation for the virtual visit.
Got it. Okay. Yeah, and I know there's sort of a temporary relaxation of, like even Medicare patients can use telemedicine, which they weren't able to before the pandemic. And, part of it is, of course, we're still very much in a state of flux because, well, first of all, the pandemic is not even over. Who knows how that's all going to work out. And then like kind of what's going to happen going down the road. If these rules might stay or they might go away or they might change. So I think part of the message is to try to be flexible around that. When the situation changes, like make sure that you are keeping yourself abreast of the developments as they happen, and that way you can pivot depending on whether it's in-person visits or online virtual care type offers. I think the other thing I want to say is, there's so many different models that can happen with lifestyle medicine. There can be you can do cash pay only. You can have a DPC practice. There's very low barriers you can do, or you can just start like with a jump start, like you said. Like a 15 or a 21-day jump start. Maybe if you don't want to deal with insurance and stuff, just make it very reasonable for people to enroll, and then advertise on social media and by word of mouth. So there's definitely different routes that can be taken. The main thing is more and more of us physicians talking it up, because I think that's a big part of it, is that as physicians, even like there's so many physicians who still are not even aware what lifestyle medicine is, so educating amongst our colleagues is important as well. So then it becomes, like now if you say internal medicine or family practice, everybody knows exactly what that is. So can we all start talking about it? You might get some pushback, but talking about, first of all, educating ourselves about the science behind it, about the evidence behind it, go to these planning conferences. Actually, this year, I think almost all of them are online. I was getting ready to sign up for the Plant Nutrition Project one. And so that's great because you can get CME and you're doing it virtually. Of course, you're going to miss all that delicious food, dang. But so I think mainly educating yourself about it, and then having just a small talk. It doesn't have to be very complex. I think a quick 25 to 30-minute talk to lay people about the science behind it. If you don't have to go into like great details and ask questions, so kind of start putting ourselves out there. And honestly, all of this I'm saying to myself too, just so you know.
Yeah, and I think Additionally, there are other things that providers can do, which is within the sort of falls into the lifestyle medicine concepts. Is a chronic care management, which is another way to bill and kind of get reimbursed, or remote patient monitoring. That's another kind of a thing that people can add to if that's the value, and a lot of new codes that are coming up with RPMs. Employee wellness, or it's another area that can be used for lifestyle medicine practices. You can sort of sign up contract with employer or big employer and work as a improve their health outcomes, lower their healthcare cost. And there are several models. You can have a chip or a similar. You can develop a program on your own for that. So yeah, as you said, our conscious practice, a lot of it's just there is no sort of limitation. I think is depending on how comfortable you feel and where you are geographically and what you can accomplish. There's a lot more ways you can make this financially viable model.
Yeah. Or even things like, just call up like your local newspaper and say, or write an article and say, can you publish this in the paper?
Yes.
Or call up your local TV show, like local cable, or the radio, for example. It's really like there's so many different ways to kind of, I think actually Dr. Bijur does a regular program on like Fox, I think, from where she's at. And I've seen a few of that on Facebook. So there's different ways to get the word out, and then your practice will grow. I think that, like you said very nicely, we kind of have this idea, we build a practice and sit there, people will come. But I think we kind of have to learn to put ourselves out there a little bit. Yeah. So the other question that came up is there a separate CPT code for shared visits, and is a modifier necessary, or is it just the 213, 214?
Yeah, there is no modifier. Just a 213 or 212, or based on number of people you have in a group, you come up with appropriate E&M codes, but no modifiers. It's just a regular visit code that you use.
That's good to know. Yeah. Mm-hmm. So what are some of the other? You did talk about sort of your future vision of expanding and stuff like that. So your community, like, what's the population like roughly of Midland? Like, what's your engagement area, I guess?
So, as last 4 or 5 years, we have had a significant growth in the population. So it's about 170,000 people now.
Okay. Right. And you've had, it sounds like you guys have had a fairly big impact on the community itself.
Yes. So we actually jumped up on our county ranking, the Robert Wood Johnson Foundation county rankings within the Texas. We bumped up. We were 41 or so a year ago. We're 29. So, yeah.
So going up the ladder. That's awesome. Do you face issues with like it being like a food? The one thing that I hear a lot after, where do you get your protein? Is the question of, there are places where literally there's no fresh fruits and vegetables available, or that quote unquote it's too expensive to eat a whole food plant-based. What's kind of been your response to those kind of concerns when they come up?
So it's proven that eating whole food plant-based diet is not expensive. You can look at any study and anywhere. What is expensive is to pay for all those prescriptions and procedures and surgeries and, all the bad health for years altogether. So, I would say people have to kind of make that choice, whether you're going to pay for your food or you're going to pay for pills and procedures. So it's a choice that we make every day. And I don't think once you present the data, patients get it. These days, everyone's prescription plan has gone so expensive, medication. Right. If the doctor writes a prescription, there is no guarantee that they're going to get that.
Yeah.
So it's a very challenging time for average patient. And I think they all want to find ways to not have to take prescription medications.
Mm-hmm.
Yeah.
So when you have a patient in your office and you think, wow, this would be like a perfect person to enroll in the lifestyle medicine clinic, and maybe they haven't quite heard about the whole program yet, what's sort of your approach to like test the waters to see if they're interested / ready and not quite like, upset, like push them away? And you
Yeah.
probably have you probably have developed a relationship because it's your own private practice. But let's just say that, you have a patient come in and you're like, oh my God, this guy's headed towards a heart attack or something. How do you approach that?
Yeah. So I think over the years, if you do this long enough, you figure it out. Like patient, when you talk to them, you kind of know whether this is worth your time or you just don't want to open up about the lifestyle medicine here. But, but what I do is subtle ways. In my waiting room, there is a video playing. It could be What the Health or, Forks Over Knives or one of those. So while they're waiting, they've kind of had some information out there. And when they come in the room, there is this Dr. Greger's, 12, the Daily Dozen picture. So, there's this subtle ways
Right.
to keep that information.
I love that.
So they get,
low cost, low tech.
Yeah. So that
subliminal messaging.
Yeah. So then they start the conversation, or you talk about it, that some of these conditions you have could be reversible if you make some changes. So you kind of gradually start the conversation and sense whether they are open to learn more or not. And I think that comes with experience. You just don't want to start everybody, with the same talk, because it'll be wasting your time.
Right.
Yeah.
There has to be, I've realized that, Padmaja, there needs to be at least a certain level of readiness, because otherwise, especially some of us, I mean, I've been doing it for 3 years, but, you're super passionate about it in the beginning and you're like, I'm going to change the world. And sometimes that can actually raise some barriers, especially because food is such a personal thing. And so you could actually end up pushing people away instead of drawing them in, and I kind of view it as like laying a carpet, it's like an invitation to consider it and leave it up to that. And they might not be ready then, but then they might be ready 3 months later or 6 months later, or or their mom just got diagnosed with, colon cancer, and they're like, oh my God, like this is what I could potentially be facing, and I need to take this serious. So you just never know when that attack might happen.
That's true. And I've had patients for say 6-7 years who know that how passionate I am, but they weren't ready, so we didn't talk about it. Now suddenly they just opened up one fine day. It's like, Doc, can you help me there? Like, yes. so yeah, I think just when they are ready, you need to just kind of be ready to share all that excitement.
Yeah, that's wonderful. Well, I think we're getting close to an hour, and it's a Sunday, which I can't even, I think only dedicated doctors can do this, We're talking about something that we're passionate about on a Sunday afternoon. Do you have any parting thoughts, any words of advice for, some of the younger physicians who are coming up, and they're there's a fair amount of frustration around like, payments and administrators running the show and maybe getting furloughed, and all these things are going on. But how do they hold that light, in them, and how can we make this be a better world and a better healthcare and better jobs for ourselves and better, health for our patients?
Yeah, and I think challenges are there every day. Even for me, I don't think this is any easy path. But I think when you witness this powerful personal transformations, or you see tears from patients' eyes because they're just so grateful for what you've been doing, and that just that just fills you up and you keep going. I think that becomes my fuel to keep going every day, because what you see, what you can reverse and the impact you have on people's lives. So I think, yes, we are in this model of, we got to make it financially viable. We are, we're not here for charity. So I think we need to find ways that we can make lifestyle medicine financially viable, because there's a lot of flexibility. And I think we just have to be more creative in the model that we create. And there is no one way about it. You could create your own version of it, whatever you want to do. And you can have a mixed model. You can bill insurance, and some you can charge patients, and whatever you want to do. But I think at the end of the day, it's this changing lives and helping people improve from this chronic disease burden is what excites me. And I think, I'm sure it's worth the trouble. It's worth striving for every day.
I love that. Thank you so much. Thank you,
Thank
Padmaja.
you.
So
Thank you.
great. I think we're going to just keep talking. We just need to keep on with this path ultimately, and support each other. And that's why I'm trying to bring on speakers to kind of show us the light and show us how you guys have done it, and then people can pick up the tips that work for them in their situation. So, yeah.
Well, thank you. Thank you for the hard work that you're doing. This was totally so remarkable, and I appreciate all your time and effort.
Thank you. I really appreciate it too.
Thank you.
I'll see you later.
Bye.
Bye, everyone.